I will be talking about direct and indirect care in this video and how it affects patients and nurses alike. Hello, welcome to NurseWorks in association with Tropical Pine Tree. Time is allocated to each resident in 3 categories: certified nursing assistants, licensed practical nurses, and registered nurses. Each group has an amount of time they are required to be with a single patient. It could mean 3 hours from the CNA, 2 hours from an LPN, and 1.5 hours from an RN during a 24-hour period. Ask a nurse how many people she is caring for and do the math. The amount you see in the federal mandates or the facility's literature means a total direct care and indirect care which is promised to one patient, which includes charting, ordering meds, doing labs and dressings, calling doctors and family, as well as a myriad of other things staff do in a day. In reality, a patient will get much less direct care and more indirect care than one might think. A facility staffing need is figured by adding up all the patients and dividing this number by the total amount of nurses or CNAs. The facility may take some liberties in how they distribute the care through the day. So if the day shift has a call-in they were not able to replace, they may add an extra nurse into the evening shift to make up for the numbers. Patients may receive more or less care for the simple reason that staffing is not correct. They also receive more or less care because of the types of medical conditions the individual patients who are in the facility have. If you are an easy patient not having many needs, the patient in the next bed or across the facility who has a number of conditions such as IVs, in-house dialysis, tracheotomy, feeding tubes, who are one-to-one or in hospice, will draw from the total amount of time divided into the amount of nurses in the facility. That means the high-need patients will be using your valuable and paid-for time. This is a common practice, and I just wanted you to be aware of that fact. A person on one-to-one care, that means one patient who has one staff stay exclusively with them, will take up to 24 hours of nursing care. But since there are only one patient, most facilities do not increase the amount of staff needed. The staffing numbers for a nursing home facility don't usually take into account how much care a resident needs, just the number of residents. So if you need extra care, that time will be taken away from somebody else. By spreading out care in this manner, it cheats patients out of the amount of care they are federally mandated to have each day. Frequently, a facility will have several one-to-one cases at the same time. This brings us to the difference between direct and indirect care. When you look at the amount of care you will receive in a facility, you should know that this number is divided between direct and indirect care. So I would like to explain to you what each one is. The number of hours you will receive in care, again, is a mixture of direct and indirect care. It is a total of every patient in the facility divided by the number of nurses and CNA on staff. Each person is receiving either more or less care according to a complex matrix. You will also want to add into the mix that nursing homes use a mix of nurse practitioners, therapists, and emergency personnel such as medics and paramedics into the staffing mix. An example would be if a nurse practitioner came to see you and spent 20 minutes with you, then went back to the desk and spent another 20 minutes working on your charts and making phone calls, you would already have spent 40 minutes of your total nursing RN care. These people who care for you, who are not your RN, LPN, or CNA, will muddy up the mix. I can't break the code down completely because it is a shadowy place. It is difficult to pin down how facilities may do this. I drew upon several sources who give their opinion by defining the difference between direct and indirect care. Direct care activities include taking vital signs, taking weight, activities of daily living such as brushing teeth, toileting, and hair care, changing bed while patient is in it, dressing and feeding a resident, assist with mobility, emergency aid and life support, EKG, CPR, dressing changes, IV insertion, monitoring, infusion and discontinuation, feeding tube insertion, flushes, care, monitoring, feeding and discontinuation, in-house dialysis, diabetic monitoring, keeping track and calorie count, range of motion, reposition and turning, transferring, setting up of equipment while patient is in the room, assist with incentive spirometry, cough and deep breathe, nasal and oral suction, gastric suction, set up, change of collection canister and monitoring of chest tubes, setting up a sterile field, assisting physician with procedures, post-mortem care. There are many other things that I haven't covered that are also direct care. Indirect care includes cleaning equipment, room care, taking specimens to the lab, phone calls, assembly of orders, scheduling appointments, stocking supplies, cleaning nursing area, cleaning the patient after the procedure is complete, supplying carts, obtaining and delivering blood products, labeling and checking lab specimens, transcribing orders, scheduling tests and procedures, ordering supplies, orienting ancillary staff, keeping logbook up to date, updating information systems. Getting back to the basics, what you see on a government site or in the nursing home literature is how much each individual should get from the nursing staff. When the facility prints the hours of patient care, people won't see a breakdown of how it is divided up. Patients figure they're to receive, for example, 4 hours of care divided up between the CNA, LPN, and RN. But be aware, most people don't think to divide that time up between 3 shifts, and they don't include how much care other people in the facility will need and draw from your time. In a perfect world, they could then expect to receive about 70 minutes of care per shift from the combination of CNA, LPN, and RN in direct and indirect care. The result could shock you and be as low as a couple minutes per shift that you are actually receiving direct care. When you start looking at nursing homes, you might be excited to see that a certain facility is offering so many services just in case you need it. This is because these services bring in extra governmental financial assistance. The government pays big time for these services, and the facility profits greatly when they give it. So, for instance, if you are a light need patient and only need meals in a safe place, and you choose a place where they care for people with trachs, IVs, feeding tubes, and the like, be aware that those high payout patient needs will most likely infringe on the care promised to you. There is so much to say on this topic that I will be revisiting this issue often. Next time, I'm going to be talking about winning over staff, how you can make staff pay more attention to you or your loved ones. Thank you for watching. If you found our video helpful, please pass it along to somebody else. And be sure to like us and subscribe. You can support us through Patreon. Look at our cool rewards.